4 phase 3 clinical trials resulted, and this has clearly shown that in the dMMR endometrial cancer population, the checkpoint inhibition should be included in these patients. I think the question is in the pMMR population. We've seen some studies that show a PFS benefit in this population, and some studies that have not really shown this. So we're still trying to understand this population. And there are some interesting exploratory subgroup analysis where maybe we'll understand if there's a subgroup that might benefit from this. But the really interesting thing is it's moved immunotherapy to the front line for the dMMR population, maybe for some patients with the pMMR population, although maybe an option for all patients. And it's really created a new needs gap in the second line where we were using immunotherapy as a single agent in the dMMR population or in combination with lenvatinib in the pMMR population. And if we're using it up front, we're not quite sure if we can sequence IO after IO. And so it's created kind of a new dilemma for us.